Hello again. I spoke yesterday about that tired old chestnut that our ageing population requires immigration on a massive scale. Without it, we are sometimes told, our hospitals would be unable to cope. The doctors from India, the Jamaican nurses, the Filipino care workers. A lot of people who hear such claims feel there must be something wrong somewhere if they could only put their finger on it. Those who feel this way are, of course, quite correct, and I shall explain why. Let us begin by looking at a small instance which forms part of a larger picture. In the description to this video, I give a link to a research paper published less than a year ago by the United Kingdom Health and Security Agency. It is entitled Diphtheria in England 2021. Permit me to quote from it. Diphtheria is a very rare infection in England due to the success of the routine immunisation programme that was introduced in 1942, when the average annual number of cases was about 60,000, with 4,000 deaths. Over the past decade, the number of diphtheria cases in England has increased from an average of 2 to more than 10 cases per year. I do hope this is perfectly clear. In 2012, there were on average just 2 cases of diphtheria in this country each year. That is 1 every 6 months. The second link I give is to a news item which quotes from a report prepared by the European Society of Clinical Microbiology and Infectious Diseases. It revealed that in 2022, there were 73 cases of diphtheria in England. In other words, the number of cases of the disease in this country is now more than 36 times as high as it was in 2012. 36 times higher. According to the European Society of Clinical Microbiology and Infectious Diseases, young Afghan males make up 97% of the cases. Now here is something very interesting. In 2012, the National Health Service had to deal with a case of diphtheria every 6 months. Last year, they were dealing with a new case every 5 days. This is quite a complex business because contacts must be traced, vaccination histories taken, additional vaccinations given, and various other things. From being a rare and unlikely event, operations of this kind are now taking place half a dozen times every month in England. Here then is a specific example of a more widespread problem that unregulated immigration brings with it. In this case, those young Afghan males are not helping the National Health Service at all. They are rather imposing a considerable and additional burden upon it and ensuring that staff are taken away from other duties to deal with them and carry out time-consuming investigations. Here's another even more alarming instance. In 2021, there were 4,425 known notifications of new cases of tuberculosis in England. I give a link to a government report which states bluntly that the majority of people with TB in England were born outside the UK. Over 4,000 people who need to be treated by the NHS for a potentially fatal disease. Not only that, a massive logistical exercise to trace and to test every family member, all the people sharing a house, workmates and so on. How much work do you think that would have entailed for NHS staff, quite apart from actually treating those 4,000 people for TB? Here are 2 clear examples which show that immigration, as well as sometimes relieving pressure on the National Health Service by providing new staff for it, can also create pressure by causing complex problems which would not otherwise have existed. TB and diphtheria are, of course, diseases which people pick up accidentally and bring to this country from abroad. Some medical problems, though, are deliberately and wittingly imported to Britain from other countries. The number of children born abroad who present in hospitals in this country with exceedingly complicated medical needs is absolutely astonishing. I'm talking here about a child who, say, has been born with congenital dislocation of his hips and also some rare disorder of the blood, combined perhaps with severe learning difficulties. This is not a case which I've invented, by the way. This is something I've actually come across. People living in Bangladesh or Iraq with a child in such a state will sometimes move heaven and earth to make their way to this country on any pretext, just so that their child can have better medical treatment than he would receive in his own country. This too exerts more strain on the NHS than can be alleviated by a few new nurses from overseas. Then too, there is the fact that net immigration to this country is now running at 500,000 a year. New hospitals are not being built at anything like a sufficient rate to cope with such an annual increase, and nor are there enough GPs and dentists to treat so many extra people. The conclusion is that although there may well be some positive result from the immigration to this country of some doctors and nurses, it is by no means certain that this is sufficient to offset the extra demand placed upon the health service by immigration. It is absurd to make such a claim without a good deal more evidence. It is entirely possible that the net result of immigration is to place extra strain on the NHS and that this outweighs any possible advantage.